Welcome to the deep dive. Today we're getting into a topic that really forces two worlds to collide that you don't normally see together,
Right.
delivering high-quality, essential social services and actually making a profit while doing it. The sources we have propose a very specific solution for healthcare access for the poor, and it's a successful private business.
And that's our mission today to really understand this approach. We're looking at sources that argue the way to bridge this gap in medicine isn't just, more government programs or nonprofits.
That's something else entirely.
Exactly. It's about using pure market principles. The people behind this model call it things like bleeding heart capitalism and social service arbitrage. We need to figure out if that's just a contradiction in terms or a real blueprint.
And the problem they're tackling is huge. It really centers on this fundamental failure in the Medicaid system.
It's not a small group of people.
No, not at all. We're talking about roughly 20% of the entire U.S. population. A family of four making less than, $33,000 a year? That's a massive group of people with a constant, guaranteed need for care.
And yet, here's the paradox, right? Despite this clear, massive need, the system just leaves them stranded. Low-income patients often can't find a doctor who will even see them. It's not just a local issue, it's a national crisis.
Okay, so let's unpack that. This crisis of access. Where do we see it most clearly?
Well, the sources use Denver, Colorado as a sort of case study. If you look at Colfax Avenue, it used to be called the longest, wickedest street in America.
Right.
And now it's basically a medical desert. You have a ton of low-income residents, lots of them on Medicaid, but almost nowhere for them to get primary care.
And when you dig into the data, the discrimination against Medicaid patients becomes really clear, even in a big city like Denver.
Oh, exactly. The numbers are pretty shocking. A study by Merritt Hawkins found that in the Denver area, only 20% of family doctors take any Medicaid patients at all.
This is 20%.
Just 20%. So, 4 out of 5 doctors are essentially refusing to serve a fifth of the country's population.
And even inside that 20%, there's this kind of legal classist discrimination happening.
Yeah, so we found many of those doctors who do accept it, they'll have these internal rules, like they'll cap it at 5 Medicaid patients a month.
Wow.
Or they'll see a patient with, say, Blue Cross immediately, but a Medicaid patient has to wait months for the same kind of checkup.
So why are they doing this? I mean, nationally, you said almost half of family doctors refuse Medicaid.
They give 2 main reasons, and they're tied together. The first one is the obvious one. Medicaid just pays less than private insurance.
Okay, that makes sense. But what's the second reason?
The second one is really the key to this whole new business model. It's the perception that Medicaid patients are just more challenging.
More challenging how?
Well, doctors complain that low-income patients are more likely to miss appointments, they have language barriers, maybe they have a hard time following complex instructions. Basically, they're seen as inefficient to serve, too costly.
So someone looked at all that, all those perceived problems, and saw a business opportunity, a guaranteed customer base with, no competition.
That is the absolute pivot. Instead of avoiding the difficulty, they designed a private practice from the ground up for these individuals.
And this wasn't a nonprofit. It was a for-profit business.
A small for-profit business. They call it underserved medicine. And they started with a focus on resettled refugees in the Denver area.
And did it work?
The numbers are pretty incredible. In just 6 years, they logged 50,000 refugee medical visits. 90% of them were on Medicaid. The other 10%, they saw them for free.
So they completely flipped the script on you can't make money serving Medicaid patients.
And this brings us back to that philosophy, bleeding heart capitalism, or social service arbitrage.
Arbitrage, that's an interesting word choice.
It is. The idea is that the inefficiency of the traditional system creates this huge opportunity. If you could be ruthlessly efficient, culturally competent, and provide, extreme customer service, you can capture the money Medicaid is already paying, cut out the waste,
And pocket the difference.
Pocket the difference. Okay, but wait. Arbitrage, pocket the difference. That sounds like you're just profiting off the poor.
Yeah.
How is this not just exploiting a vulnerable population?
That's the key question. The way they see it, they aren't exploiting the patients. They're exploiting the inefficiency of the system. They took that whole list of complaints from doctors, lateness, language issues, no-shows, and said, these aren't patient failures, these are design failures.
Structural barriers.
Exactly. Structural barriers that they could eliminate. And by getting rid of those barriers, they lower their own costs and make the patient's life way easier.
Okay, so let's get into the nuts and bolts, because this sounds, frankly, brilliant.
Mm.
How did they do it? Let's use the example from the source, the patient named Nasra. The single most radical innovation is
Yeah,
they have no appointments.
none.
Zero. It's walk-in only. No one calls ahead.
In a normal doctor's office, that would be absolute chaos. How does that work for someone like Nazra?
Well, think about her situation. She might not have phone minutes to navigate some complex English phone menu to make an appointment. But more important than that, she can't be on time.
Why not?
She relies on the bus, which is never on time. She's taking care of 3 kids and a disabled father. A 2:15 p.m. appointment is a setup for failure. It's a barrier that almost guarantees she'll be a no-show or late.
So by getting rid of appointments, you get rid of the whole problem of punctuality.
You get rid of the main reason doctors say they won't see Medicaid patients. From Nasra's side, she just shows up when she can. She usually waits less than 15 minutes, and then she gets as much time as she needs with the provider.
And from the business side?
A 0% no-show rate. A 0% late show rate. And all the money you'd spend on staff for scheduling and sending reminders, that cost just vanishes.
That's incredible. Turning a social problem into a business efficiency. What else did they do?
The whole clinic is designed for speed. The exam rooms open right into the waiting room, cutting down on steps. The doctors and nurses, they room their own patients. They stay in one room. It saves time, saves money.
And I read something about how they handle prescriptions. That seems like a huge deal for this customer base.
Oh, absolutely. Think about trying to navigate an American pharmacy as a refugee. It's a nightmare. So if Nazra's kid needs, say, Tylenol or amoxicillin,
They just give it to her.
they put it right in her hand in the exam room. They dispense key medicines right there at cost. So she doesn't have to go find it off pharmacy, wait in another line, deal with more paperwork. She just goes home.
That's not just healthcare. That's
Right.
extreme customer service.
That's what they call it. And it goes even further. They're open evenings and weekends. They do home visits. They text their patients. And the sources confirm this. They've even jumped dead car batteries for patients in the parking lot.
Wait, really? Jumping car batteries?
Yep. Because if your patient can't get home safely, you haven't really finished the visit, have you? It's about removing every single barrier.
And the result of all this?
Their customer satisfaction is so high that they've never spent a penny on advertising. Yeah, it's all word of mouth, and they're growing at 25% a year.
And the last piece of the efficiency puzzle is how they handle billing, right?
Right. They deal almost exclusively with Medicaid. The source material says it's like monogamy. It just works better.
So instead of chasing payments from 10 different insurance companies, they just become masters of one system.
They master one system, which maximizes what they get from those lower rates and just slashes their administrative overhead.
Okay, let's talk about the cost to the taxpayer. Because some people are going to hear private, for-profit Medicaid clinic and think it must be costing the system a fortune.
But the argument is the complete opposite. It's a radical cost saver. Because what happens when low-income patients can't get to a doctor? They wait until they're really, really sick. And then they end up in the emergency room for something that started as a simple ear infection.
And an ER visit costs thousands.
Thousands of dollars for something that would have cost a few hundred in a clinic. So this model is saving taxpayers a massive amount of money by preventing those catastrophic expenses.
Which brings up the comparison to the traditional safety net, the federally qualified health centers, the FQHCs.
Right, and FQHCs do incredible, vital work. They're the nonprofit backbone of community health. But here's the key financial difference. FQHCs get about twice as much government funding per visit as this private practice does.
Twice as much. And the source argues that because of how that funding works, FQHCs basically have a monopoly in their areas.
That's the entrepreneurial critique. When you guarantee funding no matter what, the source argues you risk becoming slow. Costs can creep up, and the pressure to innovate isn't as intense. They could afford to have a meeting about moving a stapler.
Whereas the private practice, with no grant.
They have to be better, faster, and cheaper just to survive. That capitalist drive forces them to be hyper-focused on speed, on cultural sensitivity, on friendliness. They have to earn every single patient.
So now we get to the bleeding heart part of the name. If they're so efficient and they are making a profit, where does that money go?
It goes right back into the refugee community. It funds a community hub called Mango House. The clinic's profits are treated as an essential business expense to keep Mango House running.
So it's not just a clinic, it's a whole ecosystem.
Exactly. The profits fund everything: feeding programs, clothing closets, after-school tutoring, English classes, legal help, mental health services, even scout groups and churches.
Wow.
It addresses all the other things that make people healthy, not just the medical side. The result is they're serving about 15,000 refugees a year at a much lower cost to the system than other options.
Now, the sources are clear this isn't an easy path.
Oh, not at all. You have all the normal business headaches, taxes, legal risks, Medicaid rates changing. And on a really serious note, because they serve refugees, they've had to deal with the bomb threats.
That's awful. But despite all that, the argument is that this model could work in most of the country.
That's the claim, that based on standard Medicaid rates, this is a replicable business model.
And the source has a really powerful final message, doesn't it? Aimed right at medical professionals.
It does. It suggests that a lot of people go into medicine full of these great creative ideas, and then the system just beats it out of them over the years.
They get worn down by the bureaucracy.
Exactly. But they don't have to give up on that idealism. The source argues they can choose underserved medicine as a lifestyle specialty, a field where you get rewarded for being creative and efficient and solving these hard problems.
And that really brings up a deeper question for you, the listener, no matter what your job is.
Right. Whether you're in tech or finance or teaching, how can you apply this kind of arbitrage thinking? This model says that maybe the best way to fix inequality is to use your own expertise, your own privilege, and see that system gap not as a burden,
But as a business opportunity,
an opportunity for innovative for-profit service.
it really makes you ask, where is the inefficiency in the world that my specific training could fix? The sources make a pretty compelling case that finding new ways to serve people might be easier and maybe even more profitable than you think.